I wonder how much money they wasted on this study. This was the first thought that came to my mind as I read the report, Association Among Dietary Supplement Use, Nutrient Intake, and Mortality Among U.S. Adults, in the May 7 edition of the Annals of Internal Medicine. They can't be serious, I thought. The National Institutes of Health actually paid money, well, the American public paid money, to conduct one of the most laughable, unscientific studies imaginable. They surveyed nearly 31,000 adults about whether they took dietary supplements in the last 30 days, and then watched to see how many died over the next 6 years. Imagine the shock when these researchers discovered that taking any random supplement had no effect on life or death. Actually, they did find that people who took more than 1,000 milligrams of calcium a day had more than a 50% increased risk of death from cancer. This part is ironic because we have been taught for years to encourage women over 50 to take 1,200 milligrams of calcium a day to prevent osteoporosis. This recommendation came from a distinguished panel of experts at the Institute of Medicine in 1997. The problem is that they didn't study osteoporosis at all, even though that's what they claimed the recommendation would prevent. Moreover, the studies they did use only lasted a few weeks, which would have made it impossible to come to any useful conclusions about bone health. Needless to say, I could never get behind that recommendation and bring myself to push it upon my patients. If this study puts a final nail in the supplemental calcium coffin, then I guess it might have been worth it. But that's not the headline you're going to read, nor is it what your conventional doctor is going to tell you. She's going to tell you that your supplements are a waste of money and we have the scientific evidence to prove it. It says right here, use of dietary supplements is not associated with mortality benefits among U.S. adults. To call this study scientific would be laughable if it wasn't so dangerous. People who do not understand science might actually believe it and stop taking something that is helping them. Perhaps next we should survey 30,000 people and ask if they took any prescription drugs in the last 30 days. Then we can follow them for 6 years and find out if those who took a prescription drug had a lower death rate. Now don't get me wrong, I'm not against prescription drugs. I'm just against stupid studies and government waste. None of us in functional medicine randomly recommends people take dietary supplements to reduce risk of death. Rather, we recommend specific supplements and drugs based on actual evidence from the medical literature and our own experience. Moreover, reducing your risk of death in the next 6 years isn't our only goal in functional medicine. Frankly, avoiding disease and death is a pretty low bar. How about enhancing quality of life by helping you create health? How about enabling you to be out and about, doing the things you love, working and playing well into your 80s, 90s, and beyond? That's what we do in functional medicine. Why doesn't the NIH study that? Well, I'll tell you why. Because it wouldn't give them the outcome they're looking for. Bottom line is, don't go throwing out your supplements after hearing the bogus report on primetime news. Make sure you know why you are taking each supplement and whether there's reasonably good evidence that is beneficial to you in some way. It is true that a lot of supplements are a waste of money, but you have to be able to distinguish between throwaway brands and high-grade nutraceuticals, and you shouldn't be taking nutraceuticals simply because you read about them on the internet and they seemed like a good investment. Work with your functional medicine doctor to create a regimen that meets your specific needs and is truly an investment in your health. I'm Dr. Ray Andrew, and this is the Medical Minute. Thank you for watching.